Hello, this is Debu Tripathy, Editor-in-Chief of Cure magazine. I wanted to spend some time discussing the new trend in what is called personalized medicine for breast cancer, or molecular medicine. There has been a lot in the media and in the press about this, and it is certainly a very exciting area of science. But what does it really mean to patients with cancer? I don't think I can cover this in one video blog, so I will start with an explanation of why we as physicians are so excited about this. Technology has moved very quickly to the point that we can sequence the entire genome, get every single base pair of the gene of a cancer cell, which is different from a normal cell, and therein lie the clues as to why that cancer cell is behaving the way it does, why it grows quickly, how it may respond to different drugs and some of the newer targeted therapies. So it's of extraordinary importance. What we are finding so far, as the data is slowly coming out and getting published on large numbers of individual people's cancers, is that for most common cancers like breast cancer and lung cancer and prostate cancer, that there are many mutations in any given cancer. However, the mutations that we are finding in the specific genes aren't very common. There isn't one mutation that seems to be common across all cancers, or even say within breast cancer, but rather there are 50 to 100 different mutations. None of them are that frequent. So that poses a challenge. We're not going to find one drug to treat everybody, but it also poses a challenge in that there are many mutations that may not be driving the cancer. We call those passenger mutations. And then there are, of course, mutations that really are making the cancer behave either aggressively or respond to certain therapies. And we have to discern which is which. The other issue is that with all of these mutations that have the capacity to affect how a cancer cell grows, if you use one or two medications that are successful, that there may be a small fraction of cells that actually carry a different set of mutations. We call this intratumoral heterogeneity, differences among the cells within a given tumor. And those cells that are resistant will eventually grow and take over the tumor. And we call this clonal evolution. These are some of the challenges that we are going to have to overcome, but the opportunities there are that we can develop specific drugs against specific mutations, and probably will need to use them in combination to overcome the small population of resistant cells in what we call combinatorial therapy. I've thrown many new terms at you today and just started to broach the subject, but we'll focus in on more specific comments as to how I believe we are going to get there in this new era of personalized medicine and molecular medicine. So stay tuned. Thanks.